We begin this morning with Dr. Rosslyn Biggs, OSU Extension veterinarian and beef cattle specialist. And today we want to talk about rabies, which is something when we were chatting before the interview, we heard a lot about as kids, but it's not quite as much in the regular conversation anymore, but it's still around.
You know, we have a lot of promotion, certainly from our companion animal veterinarians, for vaccination of cats and dogs, right? But here in Oklahoma this year, we've actually had cases in cattle, in horses, goats, and dogs as well. And so it's a concern beyond just our pets.
Right, and talk about kind of how it happens and what the risk is for these other animal groups that you mentioned.
Well, our main wildlife reservoir or carrier here in Oklahoma is going to be skunks. In fact, as I've been a veterinarian over 20 years, every skunk that I have ever submitted for testing, unfortunately, has been positive. The disease itself is caused by a virus, and there are no treatments, no cure once an animal or human becomes infected. And so vaccination is our key for prevention.
How does transmission occur between the wild animal and, say, cattle in the field?
The virus is typically carried in secretions, predominantly in the saliva. That's kind of the classic, furious mad dog that bites an animal. Same situation with a skunk. Cattle are curious by nature. They interact with wildlife, get a bite, and unfortunately can contract the disease that way.
You talked about those, the kind of mad dog symptoms, but it doesn't look that way in every animal.
It doesn't, and so we have to be, those are the classic signs we're all familiar with, but anytime we have an animal with neurologic disease of really any kind, change in behaviors, in coordination, those kind of things, rabies has to be on the list of possibilities. We can also see paralysis. That's why we see the saliva or drooling, difficulties swallowing, for instance, and really any neurologic type sign can develop because of rabies.
And there's no treatment?
No treatment whatsoever, and so that's why it becomes important to have vaccinations. And although in cattle it's not something that I would generally recommend for the entire herd, for instance, I do have certain groups of animals, particularly when it comes to livestock, large animals. Certainly our pets we want to vaccinate, but when it comes to large animals, I want to think about animals of high value, and really two types of value there. Either high economic value, bulls for instance, right? We're spending a significant amount for bulls or donor females or show animals. So that also leads to animals of high sentimental value. Those sentimental value animals also typically have a lot of interaction with humans, many times children, and so we want to make sure that they're covered with rabies protection.
What is the risk for humans with your horses or cows that you're around? How can that transmission happen too?
Transmission can happen, although the risk is relatively low. But again, because it is a virus that has no treatment, any human that would be exposed to a positive rabies animal would have to undergo rabies prophylaxis, and that's something that we really would like to not have to deal with at all.
How often do our pets need to be vaccinated, and our high value or sentimental livestock?
Sure. So it depends upon the species, and it depends upon the type of vaccine used. In our pets, there are 1-year and 3-year vaccines that are utilized, and you have to go through your appropriate boosters in order to be covered. That needs to be administered by a veterinarian. In most cases, the vaccines for large animals are going to be annual vaccines.
And the documentation is really important too, and working with a veterinarian on all of those needs, right? In case there is
in case there's an exposure.
Right, in case there's a need to look back at all of that.
We want those vaccinations administered by a veterinarian. We want to keep documentation, those rabies vaccination certificates that most folks are familiar with their companion animals. And we need to have those, we need to keep those vaccines current and keep them handy if you find yourself in the event of an exposure.
We don't want to panic, but these are some really, really good reminders about our responsibility as animal owners.
Absolutely. It is absolutely no reason to panic, but we probably want to double check where animals sit with the rabies vaccination status. And if we have some that haven't been vaccinated, we may need to visit with our veterinarian on what their recommendations would be for that.
And I think any questions, any clarity that people have, their local veterinarian in their community is really the place to start.
Absolutely. They're going to be able to assess risk for that individual animal and get you covered there.
Okay. Dr. Biggs, thank you very much.
Thank you.